Okay. Practice questions for Chapter 62 with mental health disorders. Okay, a client with delirium becomes agitated and confused at night. The best initial intervention by the nurse is what action? 1. Move the client next to the nurse's station. 2. Use a night light and turn off the television. 3. Keep the television and soft light on during the night. Or 4. Play soft music during the night and maintain a well-lit room. The answer is 2. It is important to provide a consistent daily routine in a low stimulation environment when the client is agitated and confused. Noise levels, including a radio and television, may add to the confusion and disorientation. Moving client next to the nurse's station is not the initial intervention. The nurse is collecting data on a client who is actively hallucinating. Which nursing statement would be therapeutic at this time? 1. I know you feel they are out to get you, but it's not true. 2. I can hear the voice, and she wants you to come to dinner. 3. Sometimes people hear things or voices others can't hear. Or 4. I talk to the voices you're hearing, and they won't hurt you now. The answer is 3. It is important for the nurse to reinforce reality with the client. Options 1, 2, and 4 do not reinforce reality, but reinforce the hallucination that the voices are real. Okay, the nurse is caring for a client with a diagnosis of depression. The nurse monitors for signs of constipation and urinary retention, knowing that these problems are likely caused by which situation? 1. Poor dietary choices. 2. Lack of exercise and poor diet. 3. Inadequate dietary intake and dehydration. Or 4. Psychomotor retardation and side effects of medication. The answer is 4. In this situation, urinary retention is most likely caused by medications. Option 4 is the only option that addresses both constipation and urinary retention. Constipation can be related to inadequate food intake, lack of exercise, and poor diet. A client is admitted to the inpatient unit and is being considered for electroconvulsive therapy. The client appears calm, but the family is hypervigilant and anxious. The client's mother begins to cry and states, "My child's brain will be destroyed. How can the doctor do this?" The nurse should make which therapeutic response? 1. It sounds as though you need to speak with a psychiatrist. 2. Perhaps you'd like to see the ECT room and speak to the staff. 3. Your child has decided to have this treatment. You should be supportive of the decision. Or 4. It sounds as though you have some concerns about the ECT procedure. Why don't we sit down together and discuss any concerns you may have? The answer is 4. The nurse needs to encourage the family and client to verbalize their fears and concerns. Option 4 is the only option that encourages verbalization. Option 1, 2, and 3 avoid dealing with the client or family concerns. Which nursing interventions are appropriate for a hospitalized patient with mania who is exhibiting manipulative behavior? You can select all that apply. 1. Communicate expected behaviors to the client. 2. Follow through about the consequences of behavior in a non-punitive manner. 3. Ensure that the client knows that he or she is not in charge of the nursing unit. 4. Assist the client with developing a means of setting limits on personal behavior. 5. Enforce rules and inform the client that he or she will not be allowed to attend therapy groups. Or 6. Be clear with the client regarding the consequences of exceeding limits set regarding behavior. Be clear with the client regarding the consequences of exceeding limits set regarding behavior. The answer is 1, 2, 4, and 6. Interventions for dealing with the client inhibiting manipulative behavior include setting clear, consistent, and enforceable limits on manipulative behaviors, being clear with the client regarding the consequences of exceeding limits set, and following through with the consequences in a non-punitive manner, and assisting the client with developing a means for informing the client that he or she will not be allowed Assisting the client with developing a means for informing the client that he or she will not be allowed to attend therapy groups are violations of a client's rights. Ensuring the client knows that he or she is not in charge of the nursing unit is inappropriate. Power struggles need to be avoided. Okay, that was kind of tough and much. Okay, but the nurse is preparing for the hospital discharge of a client with a history of command hallucinations to harm self or others. The nurse instructs the client about interventions for hallucinations and anxiety and determines that the client understands the interventions when the client makes which statement. The nurse is preparing for the hospital discharge of a client with a history of command hallucinations to harm self or others. The nurse instructs the client about interventions for hallucinations and anxiety and determines that the client understands the interventions when the client makes which statement. 1. My medications won't make me anxious. 2. I'll go to support group and talk so that I won't hurt anyone. 3. I won't get anxious or hear things if I get enough sleep and eat well. Or 4. I can call my therapist when I'm hallucinating so I can talk about my feelings and plans and not hurt anyone. The answer is 4. There may be an increased risk for impulsive and or aggressive behavior if the client is receiving command hallucinations to harm self or others. Talking about the auditory hallucinations can interfere with the subvocular muscular activity associated with a hallucination. Option 4 is a specific agreement to seek help and evidences self-responsible commitment and control over his or her own behavior. The nurse observes the client in a psychotic, pacing, and agitated and is making aggressive gestures. The client's speech pattern is rapid, and the client's affect is belligerent. Based on these observations, which of the nurse's immediate priority of care? Which is the nurse's immediate priority of care? 1. Provide safety for the client and other clients on the unit. 2. Provide the clients on the unit with a sense of comfort and safety. 3. Assist the staff with caring for the client in a controlled environment. Or 4. Offer the client a less stimulating area to calm down and gain control. The option is 1. The answer is 1. Safety of the client and other clients is the priority. Option 1 is the only option that addresses the client and other clients' safety needs. Option 2 addresses other clients' needs. Option 3 is not client-centered. And option 4 addresses the client's needs. Immediate priority is safety. Okay, the nurse is caring for a client diagnosed with catatonic stupor. The client is lying on the bed with the body pulled into a fetal position. Which is the appropriate nursing intervention? 1. Ask direct questions to encourage talking. 2. Leave the client alone and intermittently check on them. 3. Sit beside the client in silence and verbalize occasional open-ended questions. Or 4. Take the client into the day room with other clients so they can help watch him. The answer is 3. Clients with catatonic stupor may be immobile and mute and may require consistent, repeated approaches. The nurse facilitates communication with the client by sitting in silence, asking open-ended questions, and pausing to provide opportunities for the client to respond. The nurse would not leave the client alone. Fortunately, with pharmacotherapy and improved individual management, severe catatonic symptoms rarely occur. Option 4 relies on other clients to care for this one, which is an inappropriate expectation. Asking direct questions of this client is not therapeutic. Option 3 is the best action because it provides for client supervision and communication as appropriate. A mother of a teenage client with anxiety disorder is concerned about her daughter's progress during discharge. She states that her daughter stashes food, eats all the wrong things, and makes her hyperactive. Stashes food, eats all the wrong things that makes her hyperactive, and hangs out with the wrong crowd. While helping the mother prepare for her daughter's discharge, the nurse should make which suggestion? 1. The mother should restrict the daughter's socializing time with her friends. 2. The mother should restrict the amount of chocolate and caffeine products in the home. 3. The mother should keep her daughter out of school until she can adjust to the school environment. Or 4. The mother should consider taking time off of work to help her daughter readjust to the home environment. The answer is 2. Clients with anxiety disorder should abstain from or limit their intake of caffeine, chocolate, and alcohol. These products have the potential of increasing anxiety. Option 1 and 3 are unreasonable and are unhealthy approaches. It may not be realistic for a family member to take time off from work. A client is unwilling to get out of the house for fear of doing something crazy in public. Because of this fear, the client remains homebound except when accompanied outside with a spouse. The spouse asks the nurse, What is the name of my wife's disorder?" Which answer should the nurse give to the spouse? 1. Agoraphobia. 2. Hematophobia. 3. Claustrophobia. Or 4. Hypochondriasis. The answer is 1. Agoraphobia. Agoraphobia is a fear of being alone in open or public places where escape might be difficult. Agoraphobia includes experiencing fear or sense of helplessness or embarrassment if a phobic attack occurs. Avoidance of such situations usually result in the reduction of social and professional interactions. Hematophobia is the fear of blood. Claustrophobia is fear of closed-in spaces. Clients with somatic symptoms disorder focus their anxiety on physical complaints and are preoccupied with their health. A client has reported that crying spells have been a major problem over the past several weeks and that the doctor said depression is probably the reason. The nurse observes the client is sitting slumped in a chair and the clothes that the client is wearing do not fit well. The nurse interprets that further data collection should focus on which assessment? 1. Weight loss. 2. Sleep pattern. 3. Medication compliance. Or 4. Onset of crying spells. The onset of the crying spells. The answer is 1. All the options are possible issues to address. However, the weight loss is the first item that needs further data collection because ill-fitting clothes could indicate a problem with nutrition. The client has already told the nurse that crying spells have been a problem. Medication or sleep patterns are not mentioned or addressed in the question. Okay, a client was admitted to the medical unit with acute blindness. Many tests are performed, and there seems to be no organic reason why this client cannot see. The nurse later learns that the client became blind after witnessing a hit-and-run car crash in which a family of 3 was killed. The nurse suspects that the client may be experiencing which diagnosis? 1. Psychosis. 2. Repression. 3. Conversion disorder. Or 4. Dissociative disorder. The answer is 3. Conversion disorder. A conversion disorder is the alteration or loss of a physical function that cannot be explained by any known pathophysiological mechanism. It is thought to be an expression of a psychological need or conflict. In this situation, the client witnessed an accident that was so psychologically painful that the client became blind. A dissociative disorder is a disturbance or alteration in the normally integrated functions of identity, memory, or consciousness. Psychosis is a state in which a person's mental capacity to recognize reality, communicate, and relate to others is impaired. Psychosis is a state in which a person's mental capacity to recognize reality, communicate, and relate to others is impaired, thus interfering with the person's capacity to deal with life's demands. Repression is a coping mechanism in which unacceptable things are kept out of the awareness. A manic client announces to everyone in the day room that a stripper is coming to perform that evening. When a psychiatric nurse's aide firmly states that the client's behavior is not appropriate, the manic client becomes verbally abusive and threatens physical violence to the nurse aide. Based on the analysis of this situation, the nurse determines that the appropriate action should be which intervention. 1. Escort the manic client to his or her room. 2. Orient the client to time, person, and place. 3. Tell the client that the behavior is not appropriate. Or 4. Tell the client that smoking privileges are revoked for 24 hours. The answer is 1. The client is at risk for injury to self and others, and therefore should be escorted out of the day room. Option 4 may increase the agitation that already exists in this client. Orientation will not halt the behavior. Telling the client that the behavior is not appropriate has already been attempted by the psychiatric nurse aide. The nurse notes documentation in a client's record that the client is experiencing delusions of persecution. The nurse recognizes that these symptoms of delusions are characterized. The nurse recognizes that these types of delusions are characteristic of which thoughts? 1. The false belief that one is a very powerful person. 2. The false belief that one is a very important person. 3. The false belief that one's partner is being unfaithful. Or 4. The false belief that one is being singled out for harm of others. The answer is 4. A delusion is a false belief held to be true even when there is evidence to the contrary. A delusion of persecution is the thought that one is being singled out for harm by others. A delusion of grandeur is the false belief that he or she is very powerful and an important person. A delusion of jealousy is the false belief that one's partner is being unfaithful. A client who is diagnosed with pedophilia and recently has been paroled as a sex offender says, "I'm in treatment and I have served my time. Now this group has posters all over the neighborhood with my photograph and details of my crime." Which is an appropriate response by the nurse? 1. When children are hurt the way you hurt them, people want you isolated. 2. You're lucky it doesn't escalate into something pretty scary after your crime. 3. You understand that people fear for their children, but you're feeling unfairly treated. Or 4. You seem angry, but you have committed serious crimes against several children, so your neighbors are frightened. The correct answer is 3. Focusing and verbalizing the implied concern is the therapeutic response because it assists the clients to clarify thinking and to re-examine what the client is really saying. Option 3 is the only option that reflects the use of therapeutic communication technique. Option 1 is insensitive and anxiety-provoking. Option 2 gives advice and does not facilitate the client's expression of feelings. Option 4 does not facilitate the client's expression of feelings. it